Okay, good morning, good afternoon, everybody. Has everyone been admitted at this point? Good afternoon, everyone. As a reminder, if I could ask you when you're not speaking to mute your microphone so we minimize the background noise.
Good morning.
Good.
Good afternoon.
Good afternoon. Thank you for joining.
Good afternoon.
Good afternoon, everybody. Camille, can you let me know when everyone's been admitted from the waiting room? Are we all set?
We're all set.
Great. Okay. So good afternoon, everyone, and thank you for joining us for this fourth session in the series of practical sessions where we're going to focus on taking some of the more theoretical concepts that we learned about social norms and put them into practice here. And in particular, this fourth session focuses on the monitoring and evaluation of social norms for social norms change programs. And we're going to focus this afternoon on developing a measurement plan for a program that is looking at social norms. And I should introduce myself again. I am Betsy Costamator. I'm a social scientist at FHI 360. It's lovely to be with you all today. Okay, so first we're going to spend a little time going over again some of the essential issues around monitoring and evaluation, or the differentiating issues for monitoring and evaluation for a social norms change program compared to our other programs. And then we're going to get into a practical exercise, maybe all together in plenary or maybe in breakout rooms, depending on how many of us there are, to really work through how we would think about what indicators we would use and how we would measure and when we would measure these different factors. So, like I said, we're going to focus then on taking, the components of our framework, or what we're trying to look at, thinking about what specific social norms constructs we want to pull out or embed it, and then coming up with our measure, and then ultimately an indicator for our monitoring and evaluation plan. So we're going to walk through these different steps and ultimately have some measures and indicators. Okay, so as a reminder, what normative factors do we want to measure to monitor and evaluate social norms change? I'm going to move this out of the way. So we want to be thinking primarily around three buckets of things that we would like to measure. We want to be thinking about the descriptive and the injunctive norms. Who are the reference groups, the key individuals, power holders, etc., and what are the outcome expectancies, rewards, or penalties for engaging in these behaviors that we need to monitor. So a reminder here that the distinction, when we think about social norms, we think that there are two components that are involved, right? These are both what people are actually doing in the social sphere and what is approved of, right? So the descriptive norms are those that refer to what people are doing, and the injunctive norms are refer to what people approve of others doing. And again, remember that when we're asking people these questions, these are the perceptions about what others do, or the perceptions of what others approve or disapprove of in a social space. So ultimately, we may have a descriptive norm indicator that is tracking the proportion of respondents who perceive others in the community are getting their children immunized as the descriptive, or the proportion of respondents who perceive that others in the community approve of getting their children immunized as the injunctive norm. And again, to be thinking about for your indicators, there's one particular behavior of interest that you're asking about, right? So in these particular examples, for this descriptive, the behavior would be whether people are getting their children immunized. in this example of injunctive norms, you could switch that out and you could find out what, maybe in this case, you're concerned about norms around the behavior of getting tested for HIV. So you ask people whether they approve of this behavior, getting tested for HIV. But always you need to be asking about the norms that apply to one behavior. They may in fact affect other behaviors, but in this particular case, you're trying to track or monitor how they affect a behavior of interest. And the other important component here of your norm indicators are who's doing the behavior and who influences and whose approval matters to the behavior, right? So we'll talk about that in terms of a target population whose behavior you're trying to change for your program, and the reference group of whose approval matters to the behavior. So for instance, you might ask a question about a descriptive norm. Do you think that unmarried girls in your congregation are getting tested for HIV? And an indicator may be the proportion of congregation members who perceive that unmarried girls in the congregation are getting tested for HIV. So the target population in this case are the unmarried girls in the congregation. And then for the injunctive norm, you may ask, do you think that other members of your congregation approve of unmarried girls getting tested for HIV? And then the indicator ultimately that you're tracking over time might be the proportion of congregation members who perceive that other members of our congregation approve of unmarried girls in the congregation getting tested for HIV. And in purple, then you have the reference group here, whose approval matters in this case, or that you think it matters, are congregation members. So, yeah, okay. So then also you want to be thinking about equally important to be thinking about monitoring over time. Oops. Are outcome what I'm referring to as outcome expectancy. So these are things like sanctions or rewards, and hopefully these questions that you would be asking about outcome expectancies, these would be informed by some previous research or formative research that you've done. So you have some understanding of in your population what are the social consequences, outcome expectancies that occur to people who engage or don't engage in these behaviors. So, based on some formative research, you might be asking, how likely do you think it is that an unmarried girl in this congregation will be harassed if she's seen getting tested for HIV? And typically you want to you have your response options on some kind of scale. And then you'd think through for your scale options, what you think, where you're going to have the cutoff. So for instance, you have the proportion, you might ask, the indicator then might be the proportion of respondents who think it is very likely that unmarried girls in the congregation will be harassed. And that's what will be harassed is this, this outcome expectancy, this sanction, right, that you found out that you think is happening in the communities if people engage in this behavior, if they are seen getting tested for HIV. So before I go, to the next slide, oops, I just gave you a preview, but I'm wondering if someone could maybe unmute themselves and quickly kind of give a summary of the critical components then that we're thinking about when we're developing social norms measures and indicators. What are the must-haves in terms of a social norm measure? And please don't be shy. I think I just showed you the screen, so you probably have some sense of some of the they're just basically what are the things that we just went over that we want to be keeping in mind. You could name just one thing, maybe.
Hello.
Hello, Hadisa.
Hello.
Hello, Hadisa. Go ahead.
Let me give it a try. So when we're talking social norms, the basic things we want to measure are the behaviors, and then what people think about those behaviors or people's thoughts about such behaviors. Well, this is me trying.
Yeah, no, it's a great try. Absolutely. Exactly. So you definitely have a specific behavior of interest. Exactly. You're asking about people's perceptions of those behaviors. Mm-hmm. Anyone else have thoughts? And I think you also mentioned you're asking about people's perceptions of what's acceptable behavior, right?
Yeah.
Perfect. Great. So yes, exactly. So I'm gonna, yes. So oops. Yes, so your measure, you want to either focus on, the descriptive norm, that's what the perceptions of the behavior itself, or the injunctive, the perceptions of what is appropriate. But ideally, and really, you want to know about both. You want to know about what's the common behavior, what do people think is the common behavior in that social sphere, as well as what do people think is appropriate or approved of. But let's keep in mind that you want to refer in your measure to one specific behavior, so that it's clear what your results are pointing to, right? And you also want to make a clearly defined reference group. If you don't have a reference group and you just ask, what do you think of this behavior? Then you need it's just an individual attitude. You need to find out about what the perception is of what others think in a reference group. And you also want to, for your program, in order to figure out what where you really want to focus on a target population that you can intervene on for that program. And then it's also really good to determine or understand what are rewards or penalties that occur for engaging in this behavior. So like stigma from doing this, any kind of social consequences, or maybe rewards, from, you're socially rewarded for having children at an early age, or you're socially rewarded for engaging in a certain behavior. Okay, great. Any questions then about before I move on to, any questions about social norms measures? I'm going to turn off my video for a moment. Okay. Okay, so then let's think about different ways that we could measure the normative factors for monitoring and evaluation. And we went over this in our previous training, but we're going to focus here on four primary ways that you could measure these, right? We've seen a little bit of this already with some survey questions. They could be single item survey questions, or you could then add survey questions together to create either a scale or an indice or an index, as some people refer to them. Putting questions together as scales require, a lot of assessment of psychometric analytic properties, but I think, index is more straightforward. But in either case, what you're doing is you're putting multiple survey questions together. We also talked about vignettes and social network mapping. So let me show you examples of all of these again. So again, these single item questions that you might put in a survey would be, what proportion of others in your community, the reference group, do you think, do you think have been tested or for HIV or immunized their children? So the specific behaviors of interest, or an injunctive norm, to what extent do elders in your community approve of getting tested for HIV or using condoms? Specific behavior, the approval and the doing of these behaviors. And then showing here how you might put them all together into some kind of composite or aggregate added together kind of indicator. This is from the ACT framework, which is a framework for measuring change around female genital cutting. And they put together 8 different survey items, right? And they had a whole different about scoring directions for how to put them together. And then they determined what where the cutoff was for what social norms that are more supportive. It was a continuum of social norms being more supportive and less supportive of the abandonment of that behavior. So this is a relatively complex example, but it's an example of how you could put together different single item survey questions that are asking about different different reference groups. Here we've got immediate family, extended family, friends and peers, and community, and others whose opinions are important to you. So a number of different reference groups. And then they have, in this case, they put together both the descriptive and the injunctive into the indicator. So they asked people about the descriptive behavior of how many people are doing this behavior, are currently cutting their daughters or their children, girls, and then the expectations or the approval around that behavior. That do they expect you to continue or abandon this behavior? So we also talked about vignettes. So vignettes are more of a story, using storytelling kind of approach to engage with behaviors about to understand the social norms. This example again is from the Abadaburu project that was focused on social norms around girls' marriage, education, and nutrition in Ethiopia. Just to go through again, they developed the story around Rahima was the central protagonist in the story. They give a little context about her. She's a 16-year-old student. She lives with her parents, attends school, helps her mother. And then they give a specific, case of something that happened to her, right? That's around marriage, right? One day her cousin comes over. They announce the cousin's getting engaged, going to be married. They suggest to Rahima that she should do so. And then, at that point, if you've told the story, you've engaged your participants, then you ask the participant, to put herself or himself in the place of the protagonist, Rahima, and what would most girls in Rahima's position do in this situation. And the nice thing about vignettes is that they're especially good for really engaging with your populations, but they no longer, they've put themselves, they don't have to talk about themselves. They're thinking, they're responding as if they're Rahima, right? So they're able to like remove themselves from the picture, and just especially with maybe more stigmatized behaviors or whatever, that people might be reluctant to talk about, populations that are have more difficulty with if you give them a scale of very likely to less likely or whatever, they can just engage with the story about what would most girls do, what would most other girls expect her to do. And then you can also give a counter scenario, right? Like in this case, Rahima doesn't want to marry young. She announces that she does not want to marry, and then find out, okay, well, what would happen in that case in the story? What would the opinions of others and reactions of others be? You can find out things like, are there any circumstances where it would be more or less acceptable? So these are particularly good for formative kinds of research, really engaging with populations when behaviors are particularly stigmatized or hard to talk about, or you really don't know kind of what the social norms are, what would happen in these social spheres. Another thing you could do, we've talked about reference groups and the importance of understanding the reference groups, people who are enforcing these social norms, whose support may be needed to overcome social norms. And so there are different ways to get at who are the reference groups. And one way is this, often we embed the reference groups into the questions, how many people in your congregation or whatever. But, if we have less information, when we do that, when we embed those reference groups into the questions, we're making assumptions about who we think is important to these behaviors. And hopefully, that is informed by some formative research. But when we we know less about the reference groups, or when we want to get a more tailored approach to who the reference groups are, one approach that we could use is more of a social network mapping census, right? So going in and asking people to broadly tell us about people that they interact with, people they receive support from, people they consider to be part of their world. Has anyone on the call here used social network mapping kinds of approaches? And if so, maybe you want to say about what say a word about your experience, or I think I see, yeah, maybe just maybe just with a show of hands. I'm just curious how many people have used this kind of approach, any kind of social network mapping approach in any of their projects. Oops, I didn't mean to advance. Okay, so it looks like we don't have anyone who's used this kind of a mapping approach before. So,
Oh, I
oh,
raised
great.
my hand.
Oh, I'm sorry, I didn't see the
Okay,
hand.
that's fine.
One, you know, it's hard. I'm having difficulty switching back and forth and seeing.
Yes,
Oh,
sure.
fantastic. Maybe you could say a little word then about your experience of how this worked and how people reacted to it, how you did it.
Okay, so basically, so good afternoon, everyone. What we did to be able to find a social network mapping approach was, first of all, we identified the behavior that we want to, um, assess. And so we work largely with adolescents, where we got them to tell us who these individuals are that are within their network and what's their rating. So, for instance, who are the people in their inner circle, most inner circle network, who are at the second layer, another third layer, and all, and what kind of relationship they have with those people. What defines that relationship, and all, and what kind of influence they have on them. So, for instance, a particular adolescent is able to identify the different categories of individuals who are within their own network. So it could be another adolescent who is a peer and what kind of relationship would they have with them. It could be their teacher for those in the school, and then they would define the kind of relationship they have and what they benefit from that. And some, it could be their parents or some other persons in the community. So we had differences, different kind of networks and groupings and different kind of relationship. So for instance, a particular adolescent could have a relationship with her own peer, who's a friend, at the same time with her teacher, at the same time with her parents, but at different levels and different kinds of relationship. So that's what we've used this for. Thank you. Over.
Wonderful. Thank you, Modupe. That's super, super helpful. And so you use kind of a social ecological model where you're talking about the different levels. Is that how you did it?
Yes, basically, because they were able to define that levels of a relationship. Who could graduate, who is an innermost, who is outer layer, and outermost. Yeah.
Perfect. Yeah, exactly. You can do it with drawing pictures like that and have people put, and or I've seen it where people just draw pictures and align from themselves to other people. Otto, I think you have your microphone unmuted. Would you like to add a comment? I'm sorry, Otto, I think you're trying to make a comment, but we can't hear you very well. Did you want to maybe put it into the chat? And if you, and if you wouldn't mind, then muting your microphone. Yeah, please share any comments if you're having difficulty with your microphone. Please put your comments in the chat because I'm very interested to have people share their experiences. Wonderful, exactly. So you could do this with a picture or using this kind of a grid where you get people to enumerate all the different people that are important to them in different ways. And then once you've done that, then you go back in, as Madhuba was saying, you ask them about their relationships. You could ask, specific questions about the demographics of these people. And then, in terms of social norms, then you could ask about whether you think this person approves of or engages in the specific behavior. So this last column approves of the behavior and uses the behavior. Okay, so in terms of when to monitor, we talked about this a little bit in our previous session, but there's a big debate about how long it might take for norms to change, and these are not things that change overnight. There's no clear consensus or evidence about how long specifically it might take to see large changes in norms, but definitely we know that you should not necessarily expect to see large changes in norms over the course of your project, especially if it's a short time frame. And also there's some evidence, that attitudes typically change faster than norms because social processes are slow to change. You need a number of different individuals to change before you see a social change. So all that said, you really want to be thinking about, for monitoring and evaluating social norms change, that you want to be collecting data at repeated points so you can start to see the trends, right? So, definitively for an evaluation, you want to do you measure at baseline and again at your evaluation time point at the end point, time 3. But it's also really useful to gather some monitoring data at different points along this, throughout the project, shown here, point 1, point 2. So that's just to keep that in mind. And depending where you are in that overall project time frame, there are different, measurement methods that go along with these different measurement moments, right? And so be thinking about matching your methods with the time point at which you're collecting your data. So formative, or before you've set up your intervention, you want to be doing some formative research to identify what the norms are, what the sanctions are, reference groups, and that's where you want to be pulling in any literature out there on the topic. You want to be doing some informal discussions with the community, more qualitative kinds of assessments to find out what these are. And then at baseline, you want to verify what your understanding from formative. You want to assess, how strong the norms are, whether there are any opportunities, cracks in the norms, opportunities for the interventions. And at this point, you want to be probably doing a survey, maybe some qualitative, maybe using some of these vignettes that have been informed by your formative. And then, as I mentioned, throughout the project, you want to be trying to monitor. Monitoring is also super important in terms of, not only in terms of looking for trends for norm change, but monitoring backlash, because when we're trying to change, the social fabric, the social, socially held, behaviors, there could be unexpected consequences of our intervention. These norms, underlying behaviors could, set up a ripple effect and also change other kinds of social phenomena. So really important to be doing some monitoring of that and observation. And then finally, at end line, you want to be looking for the changes in the social norms, and you want to then correlate that with changes in behaviors and attitudes that you're also collecting. So again, probably some surveys, maybe some qualitative interviews or vignettes to ensure that you're understanding your results appropriately. Okay, and so again, what we're going to be trying to, this is just a slide to remind us that, monitoring indicators often once you've rolled all your questions up or whatever into some kind of an indicator, or your observations up into some kind of indicator, your indicator is going to be looking at that change over time, right? So that's the importance of doing things at multiple time, monitoring at multiple times, and bringing all your data together and looking at changes over time, you know, in the both the perceptions of for social norms, both the perceptions of the actual behavior and then perceptions of the approval of that behavior. So I'm going to pause there before we get into some practical exercises. Give everyone a few minutes. I just went through materials, you know, quickly. Any questions at this point? I see Modupe has your hand raised. Go ahead, Modupe.
Okay, thank you very much. So I'm just wondering, so using a survey or possibly using, as compared to using a focus group discussion, which do you think is best to assess the social norms? My inclination would go towards a focus group discussion, for instance, because for me, it's a bit challenging to quantify behavior change. Rather, I'll be wondering that an expression of opinion or perception, you know, to be able to determine if it changed over time, might give us a more, might provide a more details and information, you know, and more information in terms of maybe an intention to change or a perception that has changed, rather than quantifying, you know, that I'm at this level now. And I don't know, I'm just thinking aloud probably. But I want to get more expert opinion. Yeah.
Yeah, that that is a really great question. I have some. Yeah, so let me. I'll attempt to answer that, and then I'll pass it to Mariam. I don't know if she wants to comment on that specifically or has another question, but and others here on the call too. Some of our other experts might want to jump in on this question. I mean, I would say that I think a lot of us see the need to do qualitative inquiry for these kinds of, you know, very multifaceted kind of underlying phenomenon that are hard to, you know, it's hard to go into a community and say, you know, and ask a yes, no question about whether a social norm exists and just have people completely understand, you know, immediately understand what you're talking about. So it's hard to get to the, you know, easily quantifiable pinpoint kind of indicators for these phenomena. So qualitative inquiry, you know, is, I think, important to affirm our understanding, to you know, really firm up our understanding of these phenomena. That said, I think you need to be thinking about your programmatic needs, you know, how much time you have, you know, what your funder wants in terms of, you know, the results, and, you know, who your audience is and how easy it is to interact with the audience, or your program, but, you know, participants, you know, to the extent, you know, for instance, more vulnerable, more illiterate, more younger populations, you know, again, it might be, you know, it might be, again, harder to do a survey with them, harder to reach some of the populations, so qualitative inquiry. So I think the answer is that I would say is it depends a lot.
Okay, so it's needs-based, really.
Yeah, I think it's needs-based. Exactly,
Yeah,
exactly.
okay.
I think there's an interest, though, however, you know, in terms of really developing the evidence base that social norms matter in getting to those quantitative measures and indicators, so that we can be comparing across, you know, programs, contexts, you know, populations, and being able to say, look, you know, we really see this quantifiable evidence that social norms, you know, matter and that they're changing. but that said, I think, it depends. Yes. Any other maybe responses to that
Thank you.
question? Yeah, sure.
Because
I
that's
hope
actually been a challenging part of our project, So we've had this at formative level. Then I know it's quite resource intensive to do the qualitative, like regularly. Um, but so really it's been challenging, to continue to do that continuous measurement using qualitative to be able to respond to the gaps you have seen at formative point. Yeah.
exactly. The resource intensive piece it looms large, right? It's a big factor. Yeah, absolutely. I know. I wish there were an easy answer. I know, but that's a great question. I'm glad you raised it. I know Mariam had a question, but is there anyone else who might want to share their thoughts or experiences on Modupe's really great question? Okay. Well, thank you for that question. That was a great thought-provoking question. Mariam, I know you had your hand up. Go ahead.
Hi. Hello, Betsy. Thank you so much for your presentation so far. So I think my question wouldn't be too far from what Modupe has just said, but mine is around budgeting. So how best would you advise organizations working on programs to really get to do the social behavior change, given that we know that behaviors don't change overnight? I think the aspect for budgeting might be a bit difficult to get people to buy into, having social behavior change interventions in their program. So I don't know from your experience if you can share what timelines you had for some projects and how best you were able to probably, if within a given time, go back to your donor or your funding system to ask for more money to go into a social behavior change project. Thank you.
Mariam, also another great and really tricky question. I mean, I think, so a couple of things I would say in that. I mean, I think that there is, there's a big, movement to try to convey, so in terms of time, I would say we never have enough time. Like, ideally we would be monitoring and look at these things over, long time frames. Again, we also want to know whether these are sustainable over 5-10 years. So, I mean, that would be the ideal, right? But realistically, that's not usually what we have for a program, right? So, but I think there's a growing movement and effort to try to, convey to funders the need for longer time frames. I mean, I think that, again, we need to, that's where if we could start to develop the evidence around these shorter indicators that we could be consistently comparing over time, that larger evidence base might help us to identify smaller changes that are happening that are indicative of things going in a certain direction. But I mean, I think, I mean, I'm not sure exactly how to answer your question about budgeting in terms of if there is an ideal time frame or, but I certainly think, I think the other thing is the importance of conveying to funders that if we don't try to work on these, there's been a lot of movement, for instance, with something like with family planning, with providing the supplies and the education, and yet we still don't see those resultant changes in behavior, right? And so, and the ultimate health outcomes that we want to achieve. And so I think that's really indicative of the fact that there are these underlying social norms that are in that we need to be working on to try to really move the dial on ultimately changing behaviors. And so the importance of conveying that in a in our program planning and our proposals to funders in order to get the timeframes and the budgeting that we need for these activities. But that is certainly really a tricky question. And I don't know, again, I would open up the microphones here to other people who've had experience here who might want to give their thoughts on that. No one else want to take on that thorny question? I think it's a great question.
Maybe I can just
yes, please.
share briefly. So yes, I agree with you. It's quite a tricky thing to do, but I think that a way around it would be, so at the point of conceiving a new intervention, this could be part of the budget. So I would say, so that there was one project which was going to be implemented in 3 states. So from the very beginning, we had integrated that into the budget, even though at that point also, we were also not very clear as to how we were going to do the measurement. But the good thing we did was that we had a large chunk of money for the implementation of the social norm component of that. So midline, it was easy for us to realign the budget to be able to do some monitoring. So I think, so for new projects at the conception stage, at the design stage, it might be good to include that budget there. And you can, of course, with the flexibility of the donor, you are able to realign as appropriate. So that's basically, as against an intervention that's already ongoing, it would be more challenging to then start talking about that adaptation when the project is already on course. So really,
yes,
we think critically and think more in depth at the point of project design so that you have a budget for the implementation and the measurements.
Yes, wonderful point, Modupe. Exactly, getting this in at the inception, at the beginning of program design, so that you have the budget for it. Super important, and great point. Great. Any other questions before we move into some practical exercises of putting these ideas, getting our brains going and thinking about how to put these ideas into a M&E plan? Okay. Great. If you think of other questions, please feel free to put them in the chat. So now I'm going to just walk you through what we are thinking for some exercises. And I think at this point, Camille, how many breakout rooms are we doing breakout rooms, or are we doing this in plenary?
We'll have enough for 3 breakout rooms.
Fantastic. Okay, great. So at this point, what we're going to do is we're going to break out into 3 groups. And within our groups, each group, we're going to provide with a case study narrative and related theory of change. And these are all fictional case study based on studies that are out there, but we made up these fictional, project narratives and simple, streamlined kind of simple theories of change to go with these. So we're going to provide you with a case study narrative and related theories of change. We'll go over those in a second. And we're going to ask that you start out by identifying at least one descriptive and at least one injunctive norm that you think would be important to be monitored as part of your project, that would underlie the ultimate behaviors and goals that you want to achieve with the project. And then to think through as a group, other relevant issues that you'd want to be keeping an eye on. What might, like for instance, what might be the sanctions, the outcome expectancies, the rewards, punishments, whatever, for engaging in these behaviors. Who you think the reference groups might be here that you'd want to include. Or look at, monitoring for any kind of backlash happening in the community, sensitivity of sanctions, other social change that might be happening at this, in that environment during the time that you're doing your project. And note at least 2 of these. There can be, you can note as many as you want, but try to at least 2 of these that you think would be particularly relevant for your measurement plan. Then to think through as a group how best to measure. You might measure these normative factors, both in terms of the when, at what time points you want to be measuring these things, and with what data collection activities, survey items, vignettes, program data, etc. And then finally, to think about, rolling up however you've measured these things into some indicators. So for each of the norms in particular that you listed, develop some indicators that your program might measure. So let me go through, I'll show you quickly the case studies and the theories of change, and then the table that we're going to have you fill out in your groups. So case study 1, again, these are all fictional, right? So this is a case study we're calling Healthy Homes, and the community context here is a district in Malawi has set a goal of certifying all villages as open defecation free, but only 50% of the villages are certified. Most households do not have improved latrine, and many community members do not think they're necessary. So this is about getting people to use latrines, and I'm not going to read all of this because you can delve into it in your groups. But here is your streamlined, fictional developed theory of change, where you have the intervention activities that this project is engaging in, what their intermediate outcomes are, and what their overall goals are. So there's 4 different intervention activities this project is engaging in, 4 different intermediate outcomes, and then some overall goals of, increased use of latrines, health and nutrition in communities, and safety and reduced gender-based violence. The next case study has to do about with family size. It's called Faith and Family, faith-based family planning intervention, trying to get people to use contraceptive methods. And again, here are the here's the fictionalized, shortened theory of change, where there are 3 different buckets of intervention activities that are happening as part of this project, 4 different intermediate outcomes, and 3 different program goals, including centrally increased use of modern contraception, also improved couple communication, and decreased intimate partner violence. And then the third fictional project here is we're calling the Dakar Girls Initiative. This is about secondary school completion for girls, related to marriage, fertility, and here we have the intervention activities that are part of this fictional program, 3 different types of intervention activities, 4 different intermediate outcomes, with the overall project goals of reducing gender-based violence, improving school completion rates, and reducing early marriage. So each of you is going to get sent in a minute into a breakout room. Again, you're going to use these narratives and related theories of change to identify at least 1 descriptive and at least 1 adjunctive. Could be multiple more that you think are going on in these fictional case studies, but then also to consider the other relevant issues, rewards, penalties, reference groups, backlash, other social change you might need to monitor that could affect your project. And note at least 2 of these on their measurement plan. Determine how best to measure, both in terms of the when and the what kinds of activities. and then roll that up to develop indicators. And let me show you. And this is the table that you'll use as a group to record your thoughts about the different, again, at least one descriptive, at least one adjunctive, and then other factors. And then this will be the frequency of measurement, the approach, and the indicator. And I've given one example here in the top row of a descriptive norm. This is the example is perceptions that congregation members vaccinate their children. Maybe you would decide that it's important to measure this, again, simplify baseline, midline, endline, and maybe you want to do this with a single item survey question, and then you would roll that up to an indicator of change over time and average perceived prevalence of children being vaccinated in the congregation. Okay, so before we go into breakout groups, I'm going to pause there and ask for questions about this. Questions, points of clarification? There should be lots of different aspects of these programs. And, again, we've given you just a minimum amount of detail so you can kind of take it wherever you think most relevant, whatever descriptive, injunctive, sanctions, et cetera, you think might fictionally be involved here. But I think this should lead to a lot of rich discussion. And the idea is we'll go into these breakout rooms. I think we should have about 40 minutes or so to discuss as a group. Camille will let us know when we have about 5 or 10 minutes left, 5 minutes left, something like that, Camille. And then we could also take a quick break if you haven't done so already. And then we'll come back together in plenary and we'll share across groups our discussions and what we noted in our tables. Any questions, any points of clarification, Camille, before we send people to breakout rooms?
That sounds great. If there aren't any questions, we can go ahead into the breakout rooms.
Fantastic. I look forward to hearing what you come up with. Okay, great. Welcome back, everybody. I guess we'll give another minute or two for everyone to rejoin. And then maybe I'll ask group 1. I don't know if there's one person from group 1 who wants to report back. I don't know if it would be useful or not if you want to share your screen, group 1, to show us kind of what you came up with and what your discussions centered around. Great.
Does anyone from the group want to jump in with a quick description of what we talked about?
This looks great, so I'm interested to hear how this evolved, because this looks very detailed and impressive.
I'm happy to jump in if none of my group folks would like to. Okay.
It's okay for you to represent us.
Lovely. Okay. So we discussed the descriptive norms. Our case study was on open defecation. There was an intervention where they had healthcare workers sharing knowledge, and they looked to install more latrines, but there wasn't very many latrines in the community and not very many people used it. So the descriptive norm that we came up with was that most people do not use latrines in the community. We would measure this based on endline, midline and endline. We were discussing about how it would be useful to look at this over time and how that changed beyond just a short intervention period, such as a month. We talked about doing single or survey questions that would be quantitative, but we did talk also about how it would be useful to have some open-ended questions in there. our group did a really great job and talked about some other qualitative methods that we could use, including really useful visual tools such as mapping. So we talked about mapping the spaces in the community where clean water and defecating occur, where those spots are okay and not okay to openly defecate. And that could be a discussion point in a group setting about why and why not, and by whom it is acceptable and who not. And then in the future at Endline, we were discussing where the community would like to see latrines be installed, perhaps in areas where people is further away from existing ones that the intervention had already put in. And the use of photo voice to discuss why open defecation, what it means to folks, or how why it's still important in the community. We discussed breaking it up by women's groups, men's groups, and key influencers. And why, and here's a list of things that we wanted to ask. We went into depth, where they get their ideas from, what happens if someone chooses not to comply with the norm, what do they think about it, who are the key influencers, and what would they like to change. And we looked at the indicators being changed over time in the average perceived prevalence of the open defecation and the percent of villagers who adopted improved latrine use, and then also those who did not. And then 4, the injunctive norm. The injunctive norm was other villagers approve of when others openly defecate. We kept it quite open. There wasn't much detail in the case study in terms of who might be a key influencer there. We again did baseline, midline, and endline. And we used a very similar sort of methodology, survey questions, but here we were talking about individual interviews with healthcare workers, villagers, learners, community leaders. And we would ask questions such as, why do other people approve? What are the benefits? When it's okay, when it's not okay? Who's a deviant, say someone who does use the latrines? We had a whole bunch of questions, including at the very end, did the intervention motivate them to change? Was that influence external or intrinsical? And then connecting it also the information that was given to them from the intervention, seeing what information stuck and what was important, and what information they chose to continue sharing. And the indicators would be change over time for approval of open defecation and change in sanctions over time for open defecation. If anyone from the group thinks I missed something, please jump in, but we did a really great job.
I think you captured everything we discussed perfectly. Okay.
I am super impressed. Wow, that was a lot of thoughts that you generated, and a lot of really good ideas about measurement. So, wow, very impressive, fantastic. I'm going to pass it to group 2. Someone would like to share their screen and/or be spokesperson for your discussion.
Who was group 2, Betsy?
I think that's you. Yeah, I think that's
Okay.
you. And yeah, I'm not sure.
So Hasbi has the table, but I think Siri and Mariam, maybe one of you two may want to present the work. We had quite a lot of conversation about the norms and how to best frame them. So then we were a little bit late when it came to the last columns, but we did have quite a few ideas. Hasbi, I don't know if you have the possibility of sharing your screen. Hasbi, I hope you do, because you're the only one who has this. Betsy, why don't you move just temporarily to group 3 while Hasbi maybe solves their internet connection problems?
Okay, sure. Yeah, I can go to group 3, and we also maybe had a little bit less actually on the table, certainly than group 1, but we had a really interesting, useful discussion. Let me share my screen. Here we are. Would someone from our group, maybe Raihana or Martin, would you like to kind of talk through a bit what we discussed? Can you all see my screen? Yeah, good. Okay. Raihana, would you or Martin want to take the first pass at summarizing our discussion? Since you had a lot of good thoughts here.
Okay, let me just I thought Rahina will come in, but let me just quickly. Yeah, okay. We had well, we didn't have much that we wrote down, but for the descriptive norm, we talked about how many girls in this community marry early. Yeah, so on a scale of 0 to 10, that's most, and then to none. So yeah, so we thought that would be a good descriptive norm. Although the injunctive norm, how would your parents or family members approve of not getting married early? So we also looked at, but we tried to define, you know, jump into the, okay, to try to have defined groups, you know, reference groups. So, and then that included parents, you know, fathers and so on. Okay, so I've jumped, sorry, friends and then classmates. So we're clear that we didn't want to model up, have so many groups at the same time. So some of the questions we're asking are specific. Then, another question we therefore had was to parents. How do you think, or what do you think will happen to parents that marry off, you know, their wards early? And then, factor to measure, we looked at school enrollment, you know, girls getting married off early. And then measurement approach, we felt FGD would be a good idea because we are dealing with one, a defined group. And then secondly, we don't know the sanctions. We don't want to just be prescriptive. So we wanted to hear. So we don't know these sanctions yet. So open-ended discussions we felt would be better. We thought of using vignettes, but we felt that using vignette at this time could bias, you know, the discussions, and it may be better to use this subsequent at subsequent time point. So yeah, so I think that was our discussion. I missed out some things. Please, can others come in?
That was great, Martin. I think I would add that I found that conversation really interesting because we started off, remember that you put forward, you know, about looking at descriptive norms around, you know, in terms of how many girls, we talked about there were two behaviors implicated in this project, right? The school completion and girls getting married. And like, would we ask about a question about both and how we would need to kind of probably break that out into different questions, and that there might be different reference groups and sanctions associated with those different you know, behaviors, engaging in those behaviors. And then we had some interesting discussion then about yeah, this need to use maybe qualitative, at least initially, that we can't go in with, you know, presumptions about what these different sanctions might be. Rahana raised an interesting point about, you know, the use of vignettes, right? And whether you know, they can be used over time as well to monitor changes. And we talked about how, you know, you might want to change the counter scenarios that you're posing in the scenarios that you're posing in the stories to get reactions as your understanding of the norms evolve. And then we talked about, yeah, I guess I said the different reference groups, and then also how we want to be monitoring we started getting into this discussion about other things we would want to be monitoring at the same time. Certainly the behaviors, you know, maybe looking at the school enrollment rates or marriage rates. And then we started talking about some of the other things that could be happening in the community. So I don't think that we had a great discussion. I'm not sure if we captured it all. We had a little bit of technical difficulty because Mikhail was taking notes and he lost connection at one point, but I enjoyed the discussion, and some of that is captured here. Is group 2 now ready? Pass the baton to you all.
Yes. Thanks, Betsy. We should be ready to share now.
Great, go ahead. I don't know if you want to share your screen, Husby.
Yes, share my screen now. Does anyone from the group want to run us through, or should I go ahead?
Okay, maybe you can start. I'll contribute.
Okay, great. Let me try my best. Okay, so we had a very robust conversation on the injunctive norm. We picked young couples think that members of the church disapprove of the use of family planning, and in the baseline, we were thinking. In the measurement and frequency, we decided to go with the baseline as surveys. Under the surveys, we're getting into the population in the first 3 months of a couple's life cycle. And the midline, we decided to go with trainings and discussions just to know in the intervention what the surveys are talking about. And in the end line, I think the discussion here centered around if we had a 5-year program, probably that would be at the end of the 4th to the 5th year, we'll be discussing what the end line should be like based on the midline and the baseline that we have collected. For the single item survey questions, we decided to go with qualitative interviews and quantitative. In this quantitative, we had a very good contribution here from Maria, where she thinks we could use a mixed survey questions, and also here more specifically, this would show us if they are taking up the use of contraceptive. And the change over time in average perceived, or basically is just what we're checking here based on our injunctive norm, is to look at the influencers in the church. And here we used an example from at the point of birth of a child, who are the influencers there, the pastor's wife or the godmother, or if there are any other influencers. At the same time, we decided to also look at the percentage of people who think that the pastor's wife disapproves or agrees with the use of family planning. At this point, I think I would like to give it up to my team if they have any additions, or if I didn't capture some of their thoughts properly, because we had a lot of conversations back and forth before we arrived at this. Over.
Fantastic. That was super, super interesting, Husby. Great. Well, I really enjoyed this session with everyone today. Are there any lingering questions, thoughts, concerns that I can answer? I know this is complicated stuff, so I hope this started. Yes, go ahead. Was that a question? So if there aren't any final questions, I'm happy, feel free to follow up with myself or any of the facilitators afterwards with additional questions. I really appreciated all the engagement and, insights, experiences shared today. I think I'm going to pass it back over to Camille for a final few words, or Mikhail. I'm not sure who's going to maybe make a few final comments here. But thank you again so much.